Thank you for joining our webinar. Today we'll be discussing why you need an enterprise health cloud, so you can focus on innovation, not infrastructure. Our panel of experts for today include Kate McCarthy, a senior analyst at Forrester, Neil Gomes, the chief digital officer at Thomas Jefferson University and Jefferson Health, and Jaku Venkat, the VP of product for Progress Health Cloud.
Thank you everyone for joining this morning. It's great to have you here, and I'm excited to talk to you about enterprise health clouds for interoperability and exceptional customer experience. I'm Kate McCarthy. I'm a senior analyst with Forrester Research, and I'm going to walk you through how we look at the space as well as how we have evaluated vendors in the space in our Wave methodology. To set the stage, one of the things I want everyone to think about this webinar is that healthcare was built in an analog world, but it has a digital future. And that's incredibly important for us to consider as we think about ways to solve today's issues with rising costs, reduced affordability in the space, challenges for access, and a whole bunch of other things. If you think about how you interact with other industries, likely phone and paper are not the primary way that you or your family and friends interact with those industries, but those remain the most common ways that people interact with healthcare today. And in order to succeed as we move into the new healthcare economy, we have to really think about how to build an economy that scales for loyalty and customer experience. And the way that we look at that is by putting that customer in that first building block. And the reason that the customer has shifted there is because they have an increasing self-pay responsibility, so more skin in the game. And there's an increasing business to consumer model in all parts of healthcare, but particularly in the insurance space, as we see the percentage of individuals purchasing insurance to the market increase year over year, with now more than 60% of the market getting insurance as an individual, either through Medicare, Medicaid, or direct healthcare plan purchase. The reimbursement space is also shifting. We see more value-based care, more providers finding creative ways to work with either vendors or pharmaceutical companies or insurers to not just get reimbursed for the volume of service, but for the value of service. And those value-based care arrangements have extended beyond just traditional payer and provider, and they've begun to include pharmacy and other suppliers in the space as well. And there's an increased focus on wellness as a way to reduce cost and improve health outcomes long term. And then, just like all other industries, we see digital disruption really taking hold as innovation hits the space with increased consumer devices, increased demand for mobile connectivity. The Internet of Healthy Things enables a whole new dimension of care delivery, as well as experiences for things like shopping for care, shopping for insurance, budgeting tools, and more. And lastly, organizations are really working to serve up that 360-degree view of the customer like we've done in industries like retail. If Amazon can predict and provide alerts and reminders for when we're going to run out of things like toilet paper or paper towels, why can't we in healthcare have that same understanding of our customers and proactively engage them? As we shift into this new healthcare economy with a focus on building loyalty, we must treat our patients like customers. And the way that we define customer experience quality is with three core areas. The first being effectiveness. The experience delivers value to customers, and that basically means you have a product to sell and the person purchasing it understands what you're selling. It's not a complicated product. Ease is when they're buying that product and they've purchased it, it's not hard for them to get value out of it. It's easy to use, it delivers the value they were looking for, all of those sorts of things. And then lastly, emotion. Emotion is mostly about fostering things like trust. So people want to feel good about their experience, but in healthcare, the core tenet behind emotion and customer experience is about trust. And we know with providers, patients bring a fair amount of trust to the table because of the degree of credentialing that's involved. That trust doesn't exist with insurers or with pharmaceutical companies. And even in the provider space where trust has existed for a long time, there's a lot of opportunity to improve here. And part of how organizations deliver on emotion more successfully than they do today is by improving the ease with which consumers get value from the experience. And if you think about how healthcare is today, customer experience looks a lot like this. It's complicated. It's difficult to navigate. It's very difficult if you're a consumer and you've gotten sick or a loved one has gotten sick to simply know where to go when. If it's something more complicated than the sniffles or a broken bone, it can be very difficult, depending on where you are in the world, to figure out who to see for care. Even more difficult to understand who your insurance company will cover. And more difficult still to understand what your out-of-pocket liability might be. And then even more complicated still, what does the recovery look like? What's my prescription profile going to look like? What sort of pharmaceutical coverage am I going to have? Am I going to need a medical device? The number of variables that go into care for any given episode are complicated. And as we shift away from kind of traditional episodic care into value-based care, helping people think about their health long-term requires fundamental shifts in the way that we deliver value in our experience. And we have to simplify what we are engaging our consumers in healthcare in today. And the first thing we need to do is acknowledge that the systems of record we have cannot get us where we need to go. Our electronic health records, our claim systems are overused as more than systems of record, and we use them as systems of insight and systems of engagement. We use them for appointment scheduling and patient workflow. And these tools are not the right tools to enable this better customer experience that's so important. You see, not only are the consumers confused, but now clinicians are confused. It takes 84 clicks to get through an encounter in the average health record experience, and people don't have time for that. You see in many hospital settings that physicians now work side by side with scribes so that a person can manage the toll that those systems of record take to get through. So instead of technology making things easier, it's actually slowed down and removed some of the things people really loved about care delivery, the personalization, the getting to know our patients. It's gotten more difficult. And so as we think about the future in healthcare, we look at enterprise health clouds as a path forward, as a way to solve the fundamental issues that exist with our systems of record, with customer experience, with patient engagement. They enable us to solve the fundamental need to connect disparate data across the healthcare ecosystem. It's no longer the case that we simply need to be able to understand a patient inside our walls of our organization. We also need to understand what happens outside of those walls. What's their social footprint? What environment are they living in? What sort of food are they eating? What sort of lifestyle do they lead? Those inputs become critically important as we try to build a 360-degree view of a patient and a customer so that we can better serve them and better engage them in their health and well-being over time. And we look at an industry that is largely lagged in its adoption of cloud-based technology, finally embracing cloud as a way to solve many of these challenges. Cloud-based technologies bring agility to the space. They enable organizations to connect more seamlessly to wearables, to other consumer devices, to medical devices, to other systems, to other providers, to other data types. And this statistic we show is simply for public cloud, and we see that projected to be approaching 50% of all healthcare organizations using public cloud for data processing. Many more organizations are using private cloud or hybrid cloud deployment to solve these challenges as well. And when we fold those numbers in, we expect that an increasing majority of providers and insurers are using cloud-based technologies to handle much of the data processing necessary to solve these challenges. And as we look at, what is a real opportunity to solve holistically the challenges we're facing, we see enterprise health clouds as a great way to offer interoperability and insights to this starved industry. And we look at enterprise health clouds as doing a number of things, but at the top, providing that governance layer that's so important for securing our data, for making us feel safe that our patient or identifiable information is secure, that it's encrypted. We've got role-based access controls, sign-on authentications, all of the advanced security you would expect to see in a healthcare setting, these enterprise health clouds offer. And then fundamental to a world that's shifting away from analog and into digital, a robust application development platform lies underneath that governance layer. It enables us to connect data from disparate sources. It allows us to integrate across care delivery settings and with insurers and with pharmaceutical companies. And it allows us to deploy apps out to our customers, be it patients, be it members, be it physicians or referring providers. The way that we define an enterprise health cloud, for those of you interested in looking at this space, we look at 6 key criteria for enterprise health clouds. The first is easy integration with major electronic health record providers. It isn't the case that the systems of record we use today are going to go away anytime soon. They will remain. What we want is for them not to drive workflow, for them not to drive engagement. We want them to do what they were meant to do, which is store patient data in a record. So integration with those major providers becomes critically important for any vendor looking to enter this space. The second criteria is allowing enterprises to develop a 360-degree view of the patient. We've talked about that. That's above and beyond that system of record integration. It is connecting to other entities, be it insurance companies, be it clinical trial information. It's enabling organizations to serve up a complete view of a patient that looks at things outside of care delivery settings and traditional healthcare, and including social data, and including environmental data, and so much more. The third criteria is the ability to provide advanced analytics, including patient analytics. This could be in the box or outside the box. Fourth, the development of applications with SDKs and APIs. Fifth, providing data governance and access management. And sixth, meeting HIPAA standards for handling PHI. When we evaluate vendors in this space, we look at first their current offering. We start with systems integration, so those systems of record, the ability to ingest data from things like wearables. We then look at patient engagement. How easy is it for me to build an app that engages a patient? How easy is it for me to get analytics in this space on my patients so that I can understand what they want and what to build? And then analytics, not just for the patient, but also for the infrastructure. These vendors are taking over pieces of your operation that you might manage on your own, and you might want to see what the infrastructure is doing. So how available are our servers, what users are accessing what data, all of the things that you would expect to be able to monitor. That's a core component to the analytics we evaluated here. We evaluated governance. So how is the data stored? How is it handled? How's it managed in transit and at rest? How do we manage user authentication? How do we monitor for things like data breach? We then looked at the developer platform, and this is, not just the languages that are available, but how easy is it for a non-developer to come in and build an app? Is it something that we can have someone who maybe doesn't have deep developer skills do, or is it something that we need true developers to come into our environment and help support a build for us? And then lastly, time to market accelerators. In this wave, we put priority on the developer platform and the time to market accelerators. The reason for that is twofold. We know in healthcare, we don't always have deep expertise on our staffs to go build apps. So we want that experience to be as seamless as possible. And then time to market accelerators, one of the things you commonly hear is it takes years to install health record technologies or get a data warehouse up and running. We can't continue to take that long installing software. We need to be able to put things up quickly, and we need to be able to fail faster so that we can succeed long term. And so the speed at which we can stand these things up becomes of paramount importance. And one of the things we found amongst the leaders in this space is that many of them could integrate with the health record systems in a matter of days and be up and running in a matter of weeks, rather than months or even the years that we're used to in the healthcare space. Next, we evaluate the strategy that an organization has. So what is their roadmap? What's their pricing transparency, their vision? And their alliances. The strategy we look at puts priority on the vision behind the organization. So what are they planning to do in the future? The roadmap is, really how successful do we think that they can be executing that vision? The alliances are the partner organizations that enable these organizations to provide a complete end-to-end. We don't expect that these vendors do everything by themselves. We expect that they have robust partnerships. And so those alliances are critically important. And then pricing transparency, when we're used to spending potentially billions of dollars on health record systems, we don't necessarily have billions of dollars to go buy solutions that are going to pivot us forward as an industry. So having transparency to what the cost is particularly important in healthcare. And what we found in this evaluation is that enterprise health clouds really break down into three types of purchasers. It's a space that's still evolving, and we expect the market to be more mature, and potentially this would be three different waves in the future. But for today, we saw that there were firms that built pre-built apps and provided advanced analytics right outside of the box with cognitive capabilities embedded. And those organizations are a good fit for folks that don't want to do a lot of developer tooling in-house, that want to be able to go to a solution and have something up and running without highly customized, highly personalized experiences and with cognitive built in. The second we saw were organizations with internal development capabilities that had the infrastructure to build custom apps. So for organizations that have their own developers, that have their own BI teams, and want to be able to really customize and play with great platforms to deploy new and innovative technologies to their customers, those organizations are going to be a fit. And then lastly, we saw firms that thrive in traditional analytics, and these organizations would be a fit for those organizations looking to make a smaller step forward to solve basic interoperability issues and advance their analytic strategies, but maybe aren't quite ready to step into custom apps and things like cognitive and AI. Enterprise health clouds have diverse offerings, and we saw in our wave a good mix of performance. When you look at this graphic, we see on the vertical axis the current offering. The top of that axis are our strong performers. The further to the bottom, the weaker the performance we saw. And then on the horizontal axis, we saw strategy. So that mapping of vision and roadmap. So how successful do we think these organizations will be in the future solving the critical issues for healthcare? Weak being furthest to the left and strong performers being furthest to the right. And so you can see we have a wide mix of leaders, strong performers, contenders, and challengers in the space. And I'm very excited to see what they all have to offer in the future. I want to thank you for your time this morning. And I want to thank Kinvey for putting this webcast out.
Hi, my name is Neil Gomes. I'm the Chief Digital Officer and Senior Vice President for Technology Innovation and Consumer Experience at Thomas Jefferson University and Jefferson Health. And I'm here today to talk to you about the use of the Enterprise Health Cloud within the healthcare industry, of course, and how we've been using Progress Cloud Platform, Progress Health Cloud for our purposes of innovation and digital transformation. A little bit of information about me and my teams. If you would like to contact us, my team is called the Digital Innovation and Consumer Experience Team. We refer to ourselves as the DICE Group, and you can find us on Twitter or via the web at http://dicegroup.grp.org. We are, of course, a part of Thomas Jefferson University and Jefferson Health, but we also contract our services out to other organizations based on expertise that we've developed and solutions we've created. So if you want to get in touch with us, these are ways you could. If you want to know how to find me, you have my contact information on the screen and also my Twitter handle. So normally when I present this slide, there are animations in it, and you cannot see with the two companies and their names. But in this format, that's not going to work out. So you already know that it's Ford and Tesla. But what this example is intended to indicate is, how the value of a company can be determined by its vision to see the future, right? And Ford, a company that's been around a long time, has phenomenal revenue, but is valued, even lower than Tesla. Which doesn't have a lot of revenue. In fact, has a negative net income, and is yet valued by the market in terms of outstanding shares, at least, as much higher than Ford. And why this has happened is because Ford really never saw the future, as you might refer to it, in advance, well in advance. In the automobile industry, you have to think way, way, way in advance, because a lot of the technologies that make it into your car or your vehicle of whatever kind, usually you have to start working on that 5 years in advance, because that's the amount of time it takes to make it into a vehicle in that industry. And it's very much the same in healthcare. You have a lot of regulations, but you also have a lot of adoption issues, which maybe even in the automobile industry you may not have, because you can kind of control that vehicle, right? If you're Ford, for example. But in healthcare, it's not just about coming up with solutions and doing it quite well in advance, but it's also about ensuring that they can be adopted quickly, that they can sustain and do all of that. So you really have to see the future far, far ahead of when it's going to happen. And the good thing is, healthcare is an industry that doesn't always innovate on the threshold of things, right? I mean, the digital revolution hit other industries many, many years ago, and it didn't hit healthcare as much. It hasn't disrupted this industry as much until now. So there's lots we can learn from those other industries, and to advance our own goals and advance the experience for our consumers. You can see some of this happening in some of these industry type of surveys, with respondents or healthcare adopters, for example, shifting towards super adopters over time in a very short span of time, not even multiple decades or anything else. So this is 1 year to the next, right? So you can see that here as reported by Rock Health. Similarly, you can also see changing patterns in the way that people within these different categories, kind of millennials and Gen Xers and baby boomers, are changing in terms of the way that they interact with health systems. So even baby boomers who some time ago you'd have thought would never interact online with providers or go online to find a physician. Look at that change. 23% go online to find a physician. So this change is happening. It's all around us. Even the industry recognizes it. Like, look at the startup health data on the slide, for example. Last year, about 8.5 billion in spending on digital health. This is just funding, okay, towards digital health solutions. 8.3 billion. This year, just in half the year, it's at 6.5 billion, right? And so this is tremendous acceleration. By the end of the year, it'll be close to 12 or maybe 13 billion. So industry sees that there's a tremendous need from the consumer for digital solutions in healthcare, and that there is advantage towards developing these types of things. And you can see the acceleration from 2010 till now. It's just a tremendous acceleration. So going by all these dynamics that are around us and the transformation that's happening, how do health systems deal with something like this? Well, the best way to really deal with it is not to deal with it, but to be on the forefront of it, and is to try and predict that future. And to predict that future, we have to start inventing it right now. As Alan Kay said, the best way to predict the future is really to invent it. So why not? Why can't we do that? We have academic medical centers like Jefferson all around the nation. We have non-academic centers also. It's not that you only need to be an academic center to do it. I think you're a little bit better positioned to do it if you're an academic medical center, because you have a focus on research and you have people that can do research also. So, but innovation is everywhere. We just need to learn how to leverage it, point it in the right direction, towards a goal or a future that we envision, and then execute on it. So to give you a little context on the environment within which we operate, before we get into examples of what we have done that we think is of value in this journey towards, and are major milestones in this journey towards digital transformation and use of digital platforms in order to transform. I just thought I'd spend a few minutes on where we are. We're in the Philadelphia, the greater Philadelphia area. So that also spans New Jersey, Delaware, and other areas in Pennsylvania. It is a very, very congested market. There's lots of competitors. There's lots of universities. There's lots of health systems. It's also a very, very innovative city. So there's lots of competition in terms of other innovators in the area trying to also change this industry, not just providers, but also payers and vendors and all sorts of individuals and companies trying to do this. But there are some big positives also, apart from innovation being a huge positive, of course, being a hub for higher education and life sciences, having all these folks close by, we can also do some very, very positive things. Our proximity to large cities like New York and DC also enable this. So we see it as a big plus, but it is a challenging environment at the same time. I just wanted to bring that forward to you so that you understand the kind of environment we are working in. So now a few metrics about Jefferson. We are a large hospital system. Not many people know this, but also a university. Thomas Jefferson University has been around since 1824, so almost a 200-year legacy. Sorry, and it's an institution that's known for innovation. We invented the heart-lung machine, for example. We have we've had eminent professors like Samuel Gross, who had the Gross Clinic and invented systems like Gross Anatomy. And so, and also Jefferson's really known for being the first medical institution that insisted that its graduates needed to look and see and work with patients before they got their degree. In the past, that wasn't the case, which is where the term practice comes from in medicine, where in the past it was that you studied, you got your degree, and then you went out and practiced on patients. So in today's day and age, that would probably not work out, but hundreds of years ago, Jefferson felt that way too. And so it's a very, very prestigious institution. We have lots of students that apply to our medical school and other affiliated schools. We also, as a large hospital system and with outpatient centers and urgent care centers, we have over 13 hospitals, over 29,000 employees. But what's the most important statistic in all of this really is the 2.3 million outpatient visits, the almost 400,000 ED visits, the admissions in the hospitals, over 102,000 admissions a year. All of these are lives that we touch every day. And so anything we do, even in the digital space, on these platforms that brings value to the patients, to people that are delivering care, to our students, that's very important. The other numbers that are also important, equally important, are the number of students that we touch. These numbers are a little bit old, but now that we've merged with Philadelphia University, and we're all one university, Thomas Jefferson University, now we have over 8,000 students. So that's lives that we touch too. And then of course there are our staff. So solutions that we even create focused at staff, create great impact, over 30,000 people almost at Jefferson. So although we have a lot of challenges and the industry has a lot of challenges, there's a lot of positive in the impact that you have in designing these solutions for this industry as well as for healthcare in general. So a little more context about my teams. The Digital Innovation and Consumer Experience team, the DICE group, as I mentioned, is comprised of 4 teams: the Digital Consumer Experience team, the Innovative Technology Solutions and Platforms team, Innovative Education, and the Training, Documentation, and Support teams. And really the way they're constructed is like to have this company within a company concept, a lean startup company inside a large company like Jefferson, so that we can operate a lot faster, while at the same time being very focused on security and patient data and protecting that, but also be very agile and rapidly develop consumer-centric value-focused kind of solutions for healthcare and education. We like to simplify everything that we do. So in defining what we are doing for consumers, I always say to people, well, it's really creating a digital experience, almost like any other industry, care, learning, work, research, giving, like everything else really that's digital. You and I both operate within the digital environment every day. Even in delivering this talk right now, we are working with a digital platform here, right, to do that. So so digital is all around us, and different industries that we interact with use it well or not so well. Different companies use it well or not so well, but most of the experience really boils down, whether it's good or not, to three things we feel: access, convenience, and experience, and that's what's on the screen. We have to increase access to our services. We have to make it very easy to get to us, not just to our websites, but to us from anywhere, be it on Google, on Yelp, or wherever, health grades or whatever in terms of the healthcare industry. Then we also need to go to where people already are, so if people are using the web, using mobile, using wearables, using the Internet of Things, we need to be there. That is convenience, that anytime someone thinks, or even if they don't think about it, if we can infuse ourselves into their mindset, into their workflows, where it becomes organic. If I'm not feeling slightly well today, maybe I should get on with Jeff Connect and get on a video call with my physician and look. We have to make that almost an organic. Why not? Yeah, of course I would do that. As normal as picking up a phone and calling my physician, right? So we've got to do that. People already have smartphones, so we've got to do that. And then finally, when somebody does enter our door digitally or physically, and they do find us in the places that they're already at, we then provide a fantastic closed loop experience, both in the digital and the physical space. We operate mostly in the digital space, so I call it closed loop digital experiences, but it has to translate across both environments. That it's not, and what we mean by it is that it really takes care of the entire experience. If somebody came in for a pain in their knee and it turned out that they had a bigger issue and they needed a knee replacement, they're taken care of through the whole process of, from the time that they came in with that question mark in their head to the time where, they needed to get treated and they left the hospital. And even after they left the hospital, their physical therapy and all of that is this one big and beautiful and well-designed experience, where they don't feel like they're not left wondering about a service component, being anxious about something, being in pain or something like that and not knowing who to contact. All of that is well taken care of. We want to deliver those types of experiences in healthcare. And how do we do it? We feel there are three components that we need in this process. We need good people to help us design good solutions and engage with us as we help them design good solutions. We need great platforms, so that we can make innovation not just the currency of the few, but really the combined wealth of the many. And platforms can make that happen. Platforms enable other people within the organization to co-innovate with you, rather than keeping innovation as this currency for only IT folks or something like that in the digital sphere. So we want people to do it on their own if they can, right? And we'll maybe just guide them through that process or not even be involved in it. So that's what platforms can do. They make that part of the equation very, very easy. And then, of course, we need great partners. Both our consumers, not just our vendors, but also our donors and community and consumers, are all our partners. And with vendors specifically, we pick people that are also, they don't just have a great platform or a solution or a service, but they also are invested in our success as much as they invested in years, right? So as Diane Green says in her quote there. So, that's one of the reasons why we picked the Progress Cloud platform, or the Progress Health Cloud, because the Progress Health Cloud, enabled us to develop things a lot faster. So the agility aspect. It's also well tied into Google, so it has all the benefits that the Google platform in the backend provides. We were rapidly able to create solutions like the one you're seeing on the screen, the President's Dashboard, which was commissioned by our President and CEO, Dr. Steve Klasko, who is a great advocate of the work that we do, sees this future for digital in healthcare, and is providing for it to be realized here very well at Jefferson. And then folks like Diane Green at Google, who heads the Google Cloud platform, who saw in us this desire to create new things, do it in innovative ways, and they've supported as well through this process of innovation. So we created solutions also like this, like MyJeff Health, for example. MyJeff Health is our hospital or clinical app that enables patients to find us, make appointments with our physicians, create itineraries for when they're visiting us. So it makes it easy, seamless experience. They can also bookmark physicians that they like, and so that way, or that they visit often. So that makes it very easy for them to get to us. And then they can also learn about parking and food and all these other important things that are part of that whole experience of visiting a physician. They can also connect, of course, to our portals from this app. They can get onto Jeff Connect, which is our telemedicine solution. So all of that's available, well-rounded solution here. We also focus on building solutions for healthcare journeys, because we believe that many times people get on these journeys in healthcare, not just as episodic things where they interact with us, but pregnancy is one such journey, a very positive journey usually, and so we developed My Baby at Jeff to address that journey, engage patients, keep them involved in the process, alleviate any anxieties and all of that on the digital platform. Similarly, we're in the process of delivering cancer journeys and journeys for weight management and wellness. We also create solutions like Jeff Docs, which are mostly internally kind of directed. And Jeff Docs enables referring physicians, for example, to find us so that they can refer patients to us. And so that generates revenue certainly for us, but it also brings us patients that can avail of our services as a premier healthcare institution. We also create solutions like Jeff Champions, which is built on the Progress Health Cloud platform. And the Jeff Champions is a tool that we built for physicians to let us know immediately when a patient expresses a desire to, let's say, donate to Jefferson, because we are a not-for-profit institution. That means a lot to us. It helps us do the things we need to get done, and the way that we serve people and continue that. So it means a lot if we were to lose an opportunity like that. And so also for the patient who feels happy about the care that they've received, and want to give back to this organization. So this app enables the physician immediately to put the information in for the patient, add additional information, even if it's HIPAA compliant. It's HIPAA information, and or protected health information rather. And then this sends in this information directly to our philanthropy teams, and they then contact the patient, and they also manage the communication with the patient and the physician so that they're not overly over-communicated with, which people don't like either. So it's a very, very valuable application for our organization now. It's grown tremendously, where it's getting used a lot and is generating revenue for the institution, as well as enabling us to create these great stories with patients. So for us, the future is very simple. I think I mentioned it earlier. We like to reduce things down to the simplest forms, so the simplest forms. So if you look at the benefits of health cloud solutions for us, the benefits are that they enable us to deploy rapidly with an agile mindset, and it also propagates that agile mindset by allowing you to get to results very, very rapidly in a safe and secure kind of way. So that our developers can focus on creative development. They can work on, they can focus most of their development time on creating real solutions and creative solutions. Also, because you're working on these platforms that have economies of scale, it's a low cost to deploy. It's easy to maintain, and then scale also. Because they're doing it with other organizations that are doing a much larger scale, right? So it's easy for us to access that benefit. The enhanced security I mentioned earlier, it's again, because of the economies of scale, because they're handling more than one client, they have the ability to invest in resources that can enhance security a lot better than maybe one organization can, right? So I think that's important too. And I think there is reticence, no doubt. Many times in healthcare, especially, oh well, why are we putting? I'm not sure if I want to put my data online or in the cloud. But this was the same with electricity in the past. Everyone thought they needed to have their own, at least the large organizations, their own electric plants, and so the concept of pulling electricity from a grid in a cloud-like manner was thought of as being a little weird. And why would I do that? I have my own independence. But now everybody does it because there is benefit, global benefit to doing things like that. Allowing people that really know that business to provide that service, commoditize it, provide it as a service. So I think the same will happen with cloud, and the sooner we start leveraging it, the better it'll be for all of us. So, and in our quest for digital transformation, I think it's extremely important. It's a huge part of that success equation. And I think personally that these types of platforms, this ethos, this focus on digital will eventually change healthcare in the world. So I would say let's not do this. Instead of risking anything new, let's play it safe by continuing our slow decline into obsolescence. Let's not do that. Let's instead work together, because if you work together, you walk far. It's not just about walking fast. It's also about getting very far, moving an entire industry forward. So we have to work together as teams with great platforms, with great partners, in order to traverse this space. And again, focus on access, experience, and convenience. And then let's go invent tomorrow. Thank you.
Thank you, Neil. I really appreciate your very practical yet very extremely innovative insights. So what I'd like to do really quickly here is to talk quickly about the actual platform solution from Progress Kinvey and what that provides. So basically, if you're a developer and you want to go create some of these innovative solutions like what Neil just spoke to us about, it literally looks like this, right? You go in, you sign up, you log into the cloud, and you can go from literally just an idea to writing real code in minutes and have a concept or a MVP of your concept to show to people very, very quickly. And that's really what you're about, what we are about. And if you think about this and you think about, everything you would have to do, again, Neil alluded to this, right? So first off, you'd have to, go create all the infrastructure that you need, whether you assemble it in the cloud or go to your own internal IT organization. You need all the middleware services to surround and sit on top of that infrastructure. You need to be able to access data, whether these are, EHR systems that you need to get access to. And then you need to develop on the client side, right? All the client code that you would need, all of the operations and DevOps. And finally, again, support is really key, and having a good, being able to have a good customer experience. So you'd have to go build all of that support infrastructure. And all of this needs to be very, very secure, because you're dealing with very sensitive information in the healthcare space. And there's a lot of compliance and regulatory requirements that you have to worry about from a HIPAA perspective, or as Kate mentioned, if you're thinking about Internet of Healthy Things, you have to worry about FDA requirements as well. And on top of this, if you're, for example, picking infrastructure from the cloud, you want to make sure that your infrastructure costs are predictable. All of this is going to take you a lot of people, time, money, especially when it comes to compliance. It can be expensive, and it can take time to get done. So this is all important, but why would you want to spend your time and resources on doing this versus actually doing the innovative apps and thinking about the innovative concepts that you want to go create, and focus on some of the core competency that helps you get there, and let a platform worry about all of this, these mundane but yet important tasks. And you also want to make sure that this is all available to you from a pricing perspective in a way, because you're innovating, you don't always know exactly how successful things are going to be. So you want pricing that is more success-based, which we give you, and the success-based pricing gives you access to all the core features that are available with the platform. It's essentially reflect what Kate put together in her section of the presentation on what an enterprise health cloud is. It has SDKs, it has APIs, it has a secure place to store data, it's scalable, reliable, and of course compliant as well. So without a platform like this, it could take you a long time to get there. With a platform like this, we believe we can shorten your time frames by up to 75% or more, and we can do it all with a very, very predictable pricing model. And to summarize, really, what you're getting with an enterprise health cloud on the front end or on the experience side are app templates, widgets, SDKs that accelerate your development on this front end. And this front end is completely abstracted from the back end with serverless cloud services and APIs. So you don't have to worry about the operation costs and the operations people and time that you need to do that. And finally, very, very important is access to all of the information that resides in these healthcare systems, right? Whether these are EHR systems like Epic and Cerner, Salesforce Health Cloud, if you want information from wearables and other things through Validic, all of these things are built in, available out of the box, ready to go. So that's really, and then you have the HIPAA compliance, the infrastructure in place. It can be scaled, and all of the support is built in. And finally, any of the data that is collected as part of this end-to-end platform can be aggregated into data lakes, into business intelligence or machine learning platforms, so you can get valuable insights from the solutions that you're building. Once again, thank you everyone for your time. I think we have a couple of minutes here for Q&A. I want to thank my fellow speakers, both Kate and Neil, for their time as well.
Hi, everybody. I think we have time for one question. I have a great one for Kate, and that's what type of market adoption of enterprise health clouds have you seen? And what's holding back the people that aren't adopting it?
So it's a great question. I don't have kind of an industry stat on what the current adoption rate is, but what I would say is most organizations that I've talked to have at least deployed one of these vendors in part of their organization. And so I think the shift is less about getting organizations to adopt the technology and more about how do we get organizations to think about using the vendors they're already working with across their organization and across the ecosystem in a more connected way so that they can achieve, a broader set of goals than maybe they are with their original deployment.
Great, thanks so much, Kate. All right, so thank you everyone for joining. And like I mentioned, we'll be sending out the recording tomorrow. Thank you.